Hi, this is Nicolette Lambert with Birth Multiverse, and this is our lecture on home birth after cesarean. Now, I'm doing a lecture on this one because VBACs are considered high risk, and you're not supposed to do birth at home if you are high risk. I'm putting that in air quotes, high risk, because high risk doesn't always mean that something is going to go horribly wrong, or that something is even very likely to go horribly, terribly wrong for the mother and the baby. So we are going to talk just a little bit about the option of doing an HBAC, home birth after cesarean. So there are some possible benefits to it. Many first-time C-sections are done for stalled labor. Now, and this can be caused by the mother feeling overly stressed and threatened in the hospital. If you're uncomfortable about birthing in a hospital, home birth might have that advantage of helping you feel less stressed and helping you be able to have a labor that just progresses more normally without being stalled and whatnot. Without the use of unnecessary interventions, a lot of mothers feel more able to let go and let the baby come, and so then they avoid that stalled labor problem, which often causes the C-section. Also, a competent midwife would also not be using misoprostol or Cytotec. If you remember, we talked about Cytotec. But any competent midwife would not be using Cytotec, misoprostol, for inducing a VBAC, and that's another thing that is a very strong risk factor for a uterine rupture that happens in hospitals and doesn't happen at home. So another advantage of an HBAC is that the mother isn't on pain medication. So she might be able to better tell those sensations in her body that could be indicating that there is a possible rupture happening, that something is going wrong. Whereas in a hospital, many mothers are on pain medication, and they may not be able to be as in tune with their bodies to know if there is something that is going wrong, that the baby might be going into distress. Statistics show that only about 11% of mothers who have a C-section even attempt a VBAC in the United States, and that VBAC births make up only a very, very small percentage of actual births in the U.S. However, there is some limited data and some individual cases that do show the potential for home birth after cesarean. Now, again, this is one of those things, I love data and I love research. Unfortunately, we just don't have a whole lot of really good research on home birth after cesarean yet. We don't have a lot of really controlled studies and or cohort or studies type of a thing that can give us a lot of really broad information, but there is some research out there and it does show some promise. So again, disclaimer, home birth and VBAC are not right for every mother and every baby. And the following data is not a blanket statement. And again, I'm really against putting VBACs under a blanket statement of either you should or shouldn't, because every mother and every baby are different and there are different needs. And it should all be handled on an individual basis. And again, you should always consult a qualified birth professional when you're making a decision about how to deliver your baby. But one of the sources that we do have for some data on VBACs at home or at a birthing center in this case is the farm in Tennessee. The farm is an intentional community, also known as a commune, and they were kind of the pioneers in the mid-20th century of bringing back home birth and natural birth and midwifery. So they've been at the forefront of the resurgence of home birth and midwifery during the 1970s. I guess it's a little more late 20th century. And a number of women who have been labeled as high risk, again, air quotes on high risk, have successfully birthed there, including 127 VBAC mothers from 1970 to 2010. 123 of those 127 and VBAC mothers did successfully deliver their babies vaginally. And that gives them a 96.8% success rate, which is stunning. I don't know of any hospitals that have that high of a success rate for VBACs. Childbirth educator Amy V. Hass also received some statistics from the International Cesarean Awareness Network regarding 74 women who planned a home birth after cesarean and 64 women who planned a hospital VBAC. Now, of these 74 women who planned a home birth after cesarean, 82% birthed at home, and 6% transferred to the hospital but still had a vaginal birth, and 11% ended up with a repeat cesarean. So, of the 64 women who planned a hospital VBAC, roughly 2/3 had a vaginal birth, with almost 1/3 having a repeat C-section. So, when you look at those statistics, it does lend itself to the idea that there may be a greater chance of success for VBAC when birthing at home for some women. Statistically speaking, these scenarios where women are giving birth either at a birthing center or at home for a VBAC are tending to have a lot higher success. Now, a really good academic study would want to do a little bit more controlling for factors, are there other outside factors that could be confounding this? Are these women who are birthing at home just like lower risk, higher risk women? They have fewer risks even though they're doing a VBAC. Do these women who are having a VBAC in a hospital have additional risks? But there is some very interesting potential here for for the option of home birth after cesarean. So if you are thinking about having a VBAC, and you are interested in trying one at home or at a birthing center, like a freestanding birthing center, hospital birthing centers often don't do VBACs. Some freestanding birth centers will, though, and you should ask about that if that's an option you're interested in. Make sure to discuss with an OBGYN and your midwife what your different risk factors are, and make a decision that is good for you and your baby. And again, make sure that this is a decision that you want, because if you do genuinely feel more comfortable birthing in a hospital, and some women do, especially for VBAC, I've known some women who feel most comfortable being in a hospital because they feel like, well, if something did go wrong, then I'm right there. And, the cesarean can be performed very, very quickly for my baby. If that's what you need to feel safe, then you need to go with that too. So whatever your decision is about, if you're planning a VBAC, where you want to give birth, you need to be in tune with what you feel you and your baby need.